You know, this weekend, Americans could start signing up for health insurance through the Affordable Care Act. Much smoother than last year this time around, but there is still confusion about how it all works. Lisa Bernard-Kuhn covers healthcare reform for WCPO.com and is here to kind of walk us through it today. So thanks for coming in.
Absolutely.
All right, so yeah, this time around, one of the goals was to have, obviously as many people as possible insured. This time around, what was the difference? What made it a little bit more smoothly this time?
So one of the big, as you said, one of the big goals is to decrease the uninsured rate. And so when you look across the country nationally, we know that the rate of uninsured has dropped by about 8%. That's 41 million more Americans who have health insurance this year than had it in 2013. When you take a look at the local landscape, we see ranges of a percentage rate drop from anywhere from 2% in southeastern Indiana to as high as 7%, a 7 percentage point drop in southwest Ohio and northern Kentucky. Where we've seen those higher percentages of drops, when you think about it in northern Kentucky and southwest Ohio, those are two states that expanded Medicaid. So we have hundreds of thousands of individuals who have health insurance now because of that expansion. Indiana did not expand Medicaid. So that's one of the reasons that you still see higher rates of uninsured there.
And so as we move forward into this year, obviously the requirement is there. What happens if people do not have that insurance though?
Well, one of the key features of the Affordable Care Act is for those who don't have health insurance, they might face financial penalties. So this year, the financial penalty is the higher of 1% of your income or $95 for an individual. In 2015, that jumps up to 2% of your income or $325 per an individual. And when you look beyond 2016, it goes above $600,
so
$625 yeah, for an individual.
Now the numbers they sound staggering. 10 million people to sign up, but it's not where they want it. Why is that? Why are the numbers not quite where they want them?
So there was an original estimate a few years ago by the federal government about the number of folks that would sign up in year 2, 2015, and it was north of 13 million. Secretary, Health and Human Services Secretary Burwell came here in Cincinnati and we asked her, why was that number recently scaled back to about 10 million or 9.9 million? And she said, that was a best guess a few years ago. We hadn't unrolled or unveiled the marketplace yet. And so what she asked her team to do was take a look at the number of enrolled this time, take a look at the market to see how many would re-enroll and where the market was for new enrollment. And that's how they came up with the 9.9 million figure. There
are a million more questions that I know I have. You probably do as well. There's a phone bank and a web chat going on right now. If you have any questions or you need help signing up for coverage, and the phone bank will go until 6:30 tonight. Lisa, thanks so much. And Lisa's an expert on healthcare reform. You can read all of her stories on WCPO.com/Affordable Care Act, because again, lots of questions. And in fact, because now's the time that so many people want to sign up for open enrollment, that's the time that that the Affordable Care Act is as well. The program, of course, entering its second year, as we just mentioned. In Ohio, almost 500,000 more people have health care coverage because of the plan. In Kentucky, 55,000. Kimberly Watts is one of those who was denied for more than a decade. She says the program is a lifesaver. Coming up tonight on 9 on Your Side at 6, Chris Riva will have more about the myths behind this, figuring out what's real, what's not, the fact from the fiction. He'll separate it for you tonight on 9 on Your Side.